All right, welcome everyone. My name is Lisa Sipenko. I head Consilium Scientific, and we have a super interesting guest for you today. I would like to introduce Deborah Cohen. I've been following Deb's career and publications for quite a few years, and it's been absolutely fascinating. So I hope you enjoy today's talk. And I'm not going to tell you much about Deb's background. She will describe it herself. But very interestingly, we ended up being senior visiting fellows at the same department at the LSE. So I would say we're colleagues. So Deborah, welcome to Consilium. And my first question to you is, who are you and what are you?
What am I? Well, I guess it depends on who you ask what I am. I'm sure there'll be people out there that have fairly interesting views, for good and for bad. But I guess I initially trained to be a doctor. I studied medicine, and I think when I was at medical school, I I just thought there'd be other stuff out there as well. I couldn't see myself being in clinic all the time. And I spoke to the dean of the medical school and I thought, I'm going to intercalate. So in the UK, you can, when you study medicine as an undergrad, you can go and do a degree in something else. And I'd found out I could do journalism. And I think the dean of the medical school was really helpful. I think he probably wanted me off the wards. She's better off the wards and go and do journalism. So I did journalism, and then I did some of my training in France, and then I qualified and I went to the BMJ for what I thought was going to be kind of a sabbatical. And I didn't leave. I edited a section called analysis. So I became analysis editor, and that's kind of academic essays and controversies. But then what started happening is doctors, scientists, academics, researchers were submitting stuff that either was defamatory. So it was difficult to publish without doing kind of write a reply processes, or they get in touch, or they'd want to write about something that perhaps it was too risky for them. It was too complicated. They were sources of a particular story as opposed to actually wanting to stick the head above the parapet, which possibly tells you quite a lot about where we are with research. And so I started using journalists to help tell those stories. And then Fiona Godley, who was then editor, said, well, set up a features section, which I did, and it used all journalists. And then in 2009, the Cochrane collaboration came to the BMJ, and they were looking at the evidence for Tamiflu. They were trying to update a systematic review meta-analysis about the use of Tamiflu, oseltamivir, in influenza in healthy adults. And they were working with a UK news station called Channel 4 News, and they came to the BMJ for help with the story in many ways. And at that point, I thought, no, I'm going to do this. I want to do this story. I'm not going to commission it out. And so that really was kind of the start of doing investigative journalism. And for those people who don't know the story, the Cochrane had wanted to update their review. It was the time of the swine flu pandemic. And they wanted to try and find all the trial data. And they soon realized that 8 out of 10 trials were unpublished. And they were mentioned in a review article. So that's how we knew they existed. But the actual individual trials weren't published. And that review article was funded by Roche, the manufacturers of Tamiflu. So we set about trying to help them find the data and see if we can get the data to help them update the review. And during that time, I spoke to a whistleblower, came forward, and they had ghost written papers on behalf of Roche, with keywords in to get into the publication. So we kind of realised that actually these papers were ghost written as well. And the authors of the main trials that we wanted to get hold of, and indeed the author of the review couldn't supply any of the data, and so they weren't able to update their review with all the evidence, and that was really the start of, and that led to various other things. It led to and all helped lead the All Trials campaign, which is a campaign for clinical trial transparency. I'm sure you know all about it, and it had quite wide ramifications actually, and it was discussed at Council of Europe, European Commission, the Senate in the United States. It caused quite a few ripple effects. And I think that point for me was, oh, this is the power of investigative journalism, really. And that combination of working very closely with academics and journalists at the same time. And there was a film package that went out on Channel 4 News. So that was really the start of it. And then since then, I've worked across the board, actually, in mainstream BMJ, but then also I was a fellow in evidence-based medicine at Oxford. I worked at the BBC, Panorama, which is a investigative documentary strand. I was health correspondent of Newsnight, BBC Newsnight during the pandemic. I've worked kind of across also radio, TV, short form. Then I was science editor of ITV News, and that's a very, very different news journalism to indeed certainly the BMJ. So it's kind of a right across the piece, really, from academic journals right through to very short news clips, and everything in between. So yeah, it's been interesting.
Thank you so much. Fantastic introduction. And from what you just said, it sounds like investigative journalism is one of those absolutely glamorous jobs, film quality, like forensic scientists or criminologists. And is there an actual job like that in investigative journalist, or it's something that you fall into, or you end up finding yourself in such a career in case people are young people are interested in going in that direction? How do they become an investigative journalist?
My career is quite hard to replicate, not least because of my medical background, and I don't know. I mean, there are a few people that have done it, but none of my career was planned. I mean, I didn't sit there and go, well, that's where I want to be in 20 years time, or however. I've just kind of fallen into stuff, and oh, that sounds interesting, I'll give it a go. Or jobs come up, you apply, but there aren't loads of investigative journalism jobs, and it's hard to do. I'm freelance now, and I mean, it's not a sustainable job. If you're going to do it, you really do need to be backed by a publication or a broadcaster, and I think those jobs feel like they're fewer and far between. There's all different outfits now. I mean, you've got the Bureau of Investigative Journalism, you've got kind of these other funding mechanisms, but there aren't loads. I mean, good journalism should always have a bit of an investigative element to it. You should always be questioning. It shouldn't, it's not a case of PR. Anything else is PR. So you should always be questioning, but actually these lengthy investigations that I've done over the years, and they are becoming harder in some ways. Certainly in the UK, the Freedom of Information Act is becoming harder and harder to use. The early days of it was great. You could get loads of information, but it is becoming harder. But there's not loads of jobs out there in investigative journalism. Like I say, I didn't apply. It was kind of, I just fell into it, and I was on the BMJ, and Fiona Godley thought, we could do with an investigations editor, and that's what happened. So I was the first investigations editor there.
Fascinating. So what are the best things about being in this job, and what are the worst, you would say?
The best things, I mean, it's a hard job. I'm not gonna lie. I mean, it can take over your life. There's no particularly with healthcare, it's very international. So sometimes a lot of my sources might be on the west coast of America. So I'm dealing with them at the end of the day. So it's a very, very intense job, particularly when you're filming. You might be out, or when you're in an edit on a documentary, you can be editing till about 3 a.m. You're back in the edit suite at 9 a.m. And I mean, I've had all sorts of stuff happen to me in the course of my career. Some not very, a lot not very pleasant. The flip side is I've got a license to ask questions. I'm paid to ask questions. I speak to incredible people, not just kind of at the upper echelons of research and in the medical world, but just people every day. I get access to people's lives, to hear about their lives, to hear about their stories. I've traveled to all sorts of places, not the kind of places that you would go to, for a holiday. So again, a lot of filming in the United States, but parts of the US where you just wouldn't go to necessarily, parts of Tennessee, say, for example, or Memphis or Pennsylvania, and hearing about people's lives. The the ability to change, you know, policy or clinical practice or guidelines or something else, I mean, that's an incredibly rewarding component of it. And you do, I'm not going to lie, when you find something out, you get a leak, or you think, oh, you know, you do get a rush. You do get a rush. It is exciting. And I think sometimes the hardest stories actually are not when you get a leak necessarily, but it's what isn't there that should be there. So one or two investigations I've done have looked at submissions to, let's say, the European Medicines Agency or the FDA. And, you know, a company, for example, might have information that they have internally that they haven't provided. So you've got to go through every document available to be able to assert that, to see where the information is missing. So it can be quite painstaking. But when you find that out and you think, this information isn't there, I mean, you do have to check yourself, but you know, you do get a bit of a rush.
I can imagine that when you start digging under particular organizations or people, you also make a lot of enemies. And how does that work?
Literally, I think every story that I've done kind of has a story around it that I haven't actually told. So I mean, I've been hacked. And that was my BMJ email account, and emails were just flying out the account. I went to look for emails and they were just disappearing. And I won't name the particular story because I'm very conscious of defamation and joining. I mean, it was strange. It was just, you know, just in front of you, and things are just. And later that night, it happened in the day, and bizarrely later that night, I was going to a meeting with Hacked Off, which was, you know, a campaign group about, you know, that alleging that the press had hacked their phones. Hugh Grant is kind of one of the front faces of it. And I was talking to some of the lawyers there, and they were like, oh, you've been hacked. You know, it was kind of like nothing. So things like that have happened. I've subpoenaed in courts. You know, I've been stalked. That was particularly unpleasant. That was for 3 years. You get untold abuse. Social media enables that, but it hasn't just been on social media. And the strange situations. One conference I went to, it was a medical conference in Barcelona, and it was a diabetes conference. And again, I won't say what I just investigated, but I went, and there was lots of British endocrinologists, diabetologists there. And I walked into my room, and there was just a piece of cake and a rose on a table, like, welcome, Dr. Cohen. I thought, who's left that? And I was on hands and knees looking at this cake, sniffing it, wondering who'd left it there. And I went downstairs and I asked other doctors, and I said, did anyone else get cake and a rose in their room? And they were like, no, you didn't eat it, did you? And I was like, no. Or you know, you're in the trade hall and where all the kind of firms are, and turn your name badge round, and someone said, oh, that's not going to work, Deb. I think they might know who you are. And then, you know, being at the tail end of corporate crisis management teams, and again, you know, phone call from a source in the United States saying, by the way, this particular company have got a global crisis management team on you. We're just warning you, to try and underplay. I was at the kind of 3/4 of the way through an investigation, and they knew what was coming, and they had comms people from all over the place to try and kind of stem the impact of whatever story. And funnily enough, that story is the same story. That what happened then was the same one as when I was hacked. It was, I was working on the same story. And before that, again, a tip off that from somebody that a particular company had gathered together other UK journalists and a couple of media doctors to try and attack the story when it came out. Again, it was kind of crisis corporate comms type thing. So when you know that's going to happen to you, and you're thinking, oh, I'm not sure. It is quite strange. It is quite a strange place to be at times.
Fascinating. Looks like we found the person who got you the cake and the rose. Amanda Adler just confessed that she was the one who invited you. She didn't go as far as to say about the cake and the rose, but we're halfway through to resolving the puzzle. So fantastic. Last time we spoke, you mentioned very interesting phrase or term, investigative epidemiology. What is that?
So we're kind of playing around with terms when I was at the BMJ, but I think some of the highest impact stuff are the most effective investigations in some ways has been when we've combined a piece of original research, if you like, alongside investigative journalism. So one example I would give was we looked at the claims being made by UK fertility clinics about their add-on treatments. Now, add-on treatments are what clinics offer on top of IVF, in theory, to help you have a baby. But we scraped, and again worked with Oxford University. We pre-specified a protocol, so we didn't kind of cherry pick, so people could see the protocol about how we've gone about the research. And I didn't actually directly get involved in the research because I wanted the researchers just to get on without interference. And anytime they saw something unusual, they'd fling it kind of my direction to kind of have a look at. So it was all pre-specified. They scraped the websites of UK fertility clinics, looking at what treatments they offered, and then looked at the evidence to see if there was high quality evidence to support that particular intervention. And that was published in the BMJ, or the BMJ Open, one of the BMJ publications, I think it was Open. But it came out at the same time as BBC Panorama, and part of that I went undercover as well, at a trade show, where people were being offered all sorts of treatments again, with a lack of evidence, and weren't being told about the lack of evidence. And you know, that had good impact. I mean, I got a lot of blowback from certain sections of the industry, and it was unpleasant, so I'm not gonna lie. But it's had an impact, and the HFEA have changed how they advise people on these particular add-ons. But I think that power of working alongside, doing something original, working alongside researchers with the journalism, it kind of gives it an extra robustness, because you're looking at things systematically as opposed to the odd incidents here and there. So you've got some idea of the scale. And so we were just dubbing it investigative epidemiology at the time. So yeah, that's where that came about.
Fascinating. We need a book called Investigative Epidemiology, so it could be with a lot of contributors. So my next question to you, what kind of work would you turn down, or what kind of work interests you? Because I'm sure there's a big variety of what you can investigate. Are there any no-go areas?
I'd like to say yes, but that's something with me. I've ended up, if it's controversial, it seems to end up in my in tray. I'm like, oh, not this again. So and healthcare and I think social media, I think it's always been polarized and can be quite toxic. I mean, even pre-social media, there are certain subjects when I was on the BMJ, you think, oh no, I'm not, you know, this isn't coming my direction, is it? Or you throw it around the team like a hot potato. No one wanted to edit it. But inevitably, you know, you do. But I don't think I've turned down payment for speaking. Conflicts of it, you know, I've got to be careful of my conflicts of interest, which is hard. But I've not turned down a story as far as I can think. I mean, I ended up having to report on, for when I was on Newsnight, on gender dysphoria, puberty blockers, the Tavistock, and that was horrendous. You know, I'm not gonna lie. Reporting on that was really, really, really difficult. And I don't think any of that, up until that point, it was pre the CAS review, which looked at the service and the treatment of gender dysphoria. And I don't think any of the health and science journalists had touched it. And that ended up in my in tray. And I was like, thanks very much. So, and again, I did about 5 or 6 stories on that, and that was really hard. I mean, I've been referred to the GMC several times. I've been referred to the Committee on Publication Ethics. I was even suspended by Twitter. That was clearly pre-Elon Musk, on that particular story, for being a transphobe. And we're just asking questions about the evidence base and follow-up of people that have had major surgery, and whistleblowing concerns within a service. But that went on and on and on and on, and I was attacked in certain sections of the press, and that's happened a few times. And I do think, why did I take that story on? And it was difficult, but COVID was difficult. COVID was really difficult. Asking, you know, questions from the outset. It was hard. I remember asking a question in April 2020 about the impact of closure of schools, just, you know, because why wouldn't you? And, you know, called a COVID minimizer, a COVID denier, and all the other. But in my mind, it was like, if something is an essential service or considered an essential service, by definition, if it's that easy to close, it's not an essential service. And I was being contacted. I have friends who are teachers working in quite deprived parts of both Liverpool, where I'm from, and London, saying, you know, we've lost sight of our vulnerable kids. So kind of had to ask those questions. But COVID was really challenging, and for 2 years of, you know, fear, uncertainty, not falling into a particular camp, but just asking basic questions that you're expected to as a health journalist: benefits, harms, uncertainties, you know, of an intervention, cost effectiveness, if there is any cost effectiveness analyses, of course. You know, the level of evidence, is it high quality data or isn't it? Or is there an absence of evidence? Is there an absence of high quality evidence? That was really difficult, really, really difficult.
Obviously, to do the job you're doing takes a particular set of talents and character that you have to manage that and to enjoy it. But how do you handle this toll of pressure, potential threats, things coming up when you least expect it? You think it's a great story, you get sued, or it sounds like it's non-stop. So is there a way to cope?
I don't know whether I did. You just move on to the next thing and the next thing. And occasionally it's really nice that, you know, you can leave a legacy. So I gave a talk in, I think it was Cochrane, Italy, and it was last year. And there was an Italian orthopedic surgeon there, and he mentioned an investigation I'd done 10 years ago about metal on metal hips. And I'd forgotten I'd done it. And so it can, for better or worse, leave an imprint. But I don't know, you just move to the next, to the next, to the next, to the next, without really stopping to think at times. And I'm not entirely sure that's entirely healthy, to be perfectly honest. And it does, it does grind you down at times. And I mean, I was pretty burnt out. That was as much to do with kind of COVID, reporting on that solidly, and reporting on the Tavistock. That took its toll. Because every time someone would send me a tweet, so that I'm like, I can't look at it, I'm blocked, you know. And that's a bit, you know, it's a constant reminder that there's people really don't like you.
And well, you handle it gracefully, and to the outside world, they would never know, even believe the stuff you're going through or might have gone through. So impressive. We had quite a few examples of speakers, whistleblowers who took the hit and went through real hell going into a particular story, reporting a particular, let's say, crime or misdoing in their organization. But whistleblowers and investigative journalists are very, very different people. And my question to you, what either should be a relationship between the two, or what is it now? And is it typical for whistleblowers to seek out people like you to make it public, or it's actually a taboo because they might do it like more harm? So what is the connection, and what it should be or what it shouldn't be, from your opinion?
I mean, whistleblowers do come to me. I mean, and that's how I get stories. There was a whistleblower that came to me. I did a couple of stories for the BBC for Newsnight about coronary artery bypass grafting versus stent, and it was a clinical trial that had been published in the New England Journal of Medicine, and they had an endpoint So there's two definitions of myocardial infarction, and even though they were measuring both, they'd only measured the more favourable, they'd only published the more favourable outcome. And this was a trial that was funded by a particular stent manufacturer. And whistleblowers came to us with that, and actually, and then if you use the other definition of MI, which was the one that's universally agreed, myocardial infarction, then that changed, and it was a composite endpoint of various different outcomes. It changed the outcomes of the trial, and showed coronary artery bypass grafting to be more effective. And that came to us via a whistleblower to start off with, and then we got more whistleblowers as we started to investigate. And a biostatistician analysed the data for us, so we got a leak of data from the trial that was the endpoint that was missing. And there were people taking real risks to get that out into the public domain, and that had an impact of withdrawing kind of guidelines. So the surgeons withdrew support for guidelines on coronary artery bypass grafting versus stenting. So and the thing is, I don't know what's happened to those guidelines, so you just move on to the next thing. And sometimes whistleblowers come to me, by the time they come to me, they're quite traumatized. I know we use that word, I use that word, advisedly, but they've butted up against the system, they haven't been heard, they've been swatted back, their fellow colleagues think they're going mad, and possibly they are, because they're in a really difficult situation. So by the time they get to me and I'm listening, you can end up with quite a complicated, you have to marshal that relationship quite carefully. And I always say to them, what is going to happen to you? Before I work on this story, what are people going to say about you? Think about what are people going to throw at you? What's going to come back to me when I'm going to have to go out with writer replies, with allegations? What are people going to say about you? How are you going to feel? So I spend a while before doing that, if the whistleblowers, particularly if the whistleblowers on the record, talking through the implications of speaking out.
Mm-hmm. You brought already forward a couple examples where your investigation you've been involved with, maybe with other people, really led to significant impact, changing guidelines, influencing policy. Throughout your career, in terms of stories you've done, do all of them make impact? Do all of them kind of connect with people? Or some might relate to policy, not all of them supposed to connect to policy, correct? That sometimes you might just be talking about some wrongdoing of the particular organization or something like that. But do you always get an impact, or rarely?
It's really hard to say. I mean, because some of it is timing. I'd like to say it was all my journalism that had the impact, but actually sometimes I'm picking up on something where there's already concerns, already movement afoot, and I just happen to be the person that picks it up and it tips it over. So I'd like to think it was all me, but it's really not. And actually it can be quite hard to predict. So sometimes certain subjects you get into and you think, this is just going to explode. Like, I knew I probably had been a little naive actually about how explosive doing stuff on puberty blockers had been. COVID, I didn't expect to be so explosive. It really was. Not that I necessarily had impact there, but it just marshalling the amount of evidence coming in the direct, with all the preprints and everything else, and then sometimes and then there's the bizarrest thing that really sparks people off. So I did an investigation 2012 about sports drinks, sugary water. That absolutely went off. And it was like, there was such a belief in the effectiveness of giving people a sports drink. I was not expecting the amount of blowback there. And again, guidelines did change and stuff like that. But my cousin, who works in football, was just seeing me get pilloried left, right, and centre. This magic nectar that transforms people overnight. If you sip a bit of the magic nectar, it was just like, no, it was kind of like, oh my word. And it's times like that. Sometimes you just don't know how things are going to go off. And one, and knowing Amanda's there, was about insulin. and about different kinds of insulin. And I went to a conference and people would say, and it was criticizing kind of the evidence for analog insulin opposed to human insulin. And, it was, anyway, I'd gone to a conference and people were saying, I can't believe you're showing your face here. And I was like, okay, just asked a few questions about an evidence base. So I don't know, sometimes, and I didn't think that was that controversial, but it was. And sometimes you just don't know.
Sounds like a life is full of excitements.
I could do with a little less of that kind of excitement, to be perfectly honest.
So we have a question from Alan Cassell. So he puts forward a quote from William Randolph Hearst, who said, allegedly news is something somebody does not want printed. All else is advertising. In your opinion, what percentage of mainstream health reporting these days would you consider largely promotion, advertising, or marketing?
There's a lot. And I think, again, with social media, there's more and more and more. I mean, I'm just doing a piece at the moment with Margaret McCartney, who people may or may not know, who's a GP and works. I've kind of got a bit of a partnership with her these days, writing about a lot of claims and evidence. But, we did a piece last year about the Zoe app. For those people who don't know, it's a continuous glucose monitor. It's more than a continuous glucose monitor, but people get personalized feedback based on continuous glucose monitoring. This is not people with type 1 or type 2 diabetes. This is otherwise healthy people and with microbiome and stuff. And people had just swallowed the hype. And then we looked at the evidence with the help of a couple of other, with a couple of people at Oxford, actually, and critiqued their clinical trial that purportedly showed actually it's better than, well, actually I think the control group was a dietary leaflet. But yeah, and there was a lot of puff around that, for want of a better expression, and I see quite a lot in other stuff. And but the thing is, it takes time. And what I remember one journalist saying to me, and I won't name her, but she said, you've got the confidence to do this stuff. And I was just like, no, I don't know anything. I'm skeptical about stuff. And I know what I don't know, which is a lot. As opposed to anything else. And knowing what you don't know is often a way to kind of ask those questions. It's not you necessarily interrogating stuff. It's just, I don't know the answer. And that was particularly the case during COVID. Like, the rest of the team at Newsnight would come to me and say, what's this about? And I'm like, I don't know. They don't want your health editor saying, I don't know. A lot of the time I didn't. But I just thought, well, I'm going to ask the question.
Very brave. We have quite a few questions coming up, and this one is from Amanda. And actually, I had that same question in my mind when you mentioned about freedom of information, getting it becoming more difficult. Why do you think is that?
Well, I think, again, a story I'm doing at the moment, I think some institutions now, academic institutions, spin off. They spin off into companies. So you set up a company, it's not subject to the Freedom of Information Act. The Freedom of Information Act is public bodies, basically. So local authorities in the UK, like NHS England, National Screening Committee, NICE, NHS, trusts. But certainly for some of it, you spin it off. And I think, I mean, it'd be interesting to hear Amanda's take on this. This is just my sense. I think organisations are wiser, so people don't put stuff in email, or they might use personal email address, which aren't subject to freedom of information, or you might use WhatsApp or other things like that. So, but I think there's, and I think there's a lot of batting things back and just hoping the journalist goes away or gives up the ghost and doesn't go to the Information Commissioner's office, because you've drawn it out that long that the story's just going to go. So you can just bat people away for as long as you can. But it used to be fruitful. I mean, I've done a few recent investigations using FOI with Margaret McCartney, one on a drug called inclisiran and another one on Grail, which is a multi-cancer detection test. And it was difficult. It was really, really, really difficult to get the information. You just end up with snippets here and there and rely on sources, off the record sources, to kind of help you join the dots together. But it is a lot harder. In fact, it was nice on one of those stories is in Clissaran, it was nice that actually did release the information in a way that they should do, and they enabled that story because they were responsive to freedom of information, and rightly so, and that was good. So it was nice, it's kind of transparency in many ways that enabled that whole story to happen. But in other times it's forget it, it's a nightmare.
Can an organization actually be sued for not releasing information under the Freedom of Information request?
They can get a ticking off from the Freedom of Information, from the Information Commissioner's office. So you will go to the Information Commissioner and say, these are the grounds I think I should have this information, and they can then force that organisation, in theory, to release the information. That tends to be how it works.
I once had an experience with a public body where I requested information and the response was, it will take us over 30 hours to respond to your question. So we won't respond to it. So we had to file maybe, I don't know, 30, 30 requests to try to get the little bits.
And they can say they're vexatious then, you see, if you do too many. So there's all workarounds. And if you do that, and so in many ways, you have to do quite a lot of journalism before you actually draft that FOI. You can't just really go on a fishing expedition these days. So you have to do, and this is one of the uses, where I use it is if I want to protect sources, but get to information. So I ask them to help me think about what I need to put in an FOI to get the information. And that's as much because the source is too scared to go on the record or even leak stuff, because they might be one of the only people that have seen that. So when I do get leaks as well, is I make sure there's quite a few people that have seen it, so it's not, so it conceals the source, so the source isn't identified. If only one or two people have seen an email, then the source is quite readily identifiable, because people might know where the information has come from. But if there's a group, and we know with emails they get passed on, so yeah, and then obviously if they're passed on so many times, you think, well, you know, how reliable is this email? Has it been edited or doctored in any way? So you do have to be careful about things like that.
So we have a question from Dorothy Bishop, who is wondering whether you've been surprised at recent exposure of fraud and high-profile research on Alzheimer's.
Sorry, have I been surprised at?
Have you been surprised on fraud in high-profile research on Alzheimer's?
I'd like to say yes, but no. And I think I remember Fiona Godley saying to me, we've got to remain surprised and shocked. You know, we can't, because the risk is you become, and I'm not cynical really, I still, believe it or not, try and see the best in people. But it doesn't. And I think the pressure on academics and doctors to get publications, you know, to get funding, it's all those sorts of pressures, and that isn't a justification of fraudulent research or you know, fraudulent papers. I mean, we saw with all the ivermectin stuff as well, but it doesn't surprise me. I wish it did, but it doesn't. But also the impact of that, and how, I mean, one story that I did with Paul Garner, who's at Liverpool School of Tropical Medicine, was about animal research, and how, again, that animal research had been misrepresented in grant applications to get a clinical trial off the ground in South Africa. And that was for a BCG booster, because BCG is not a particularly effective vaccine, particularly in countries where, you know, TB is so prevalent. And the devastating thing there is, not only was that trial shown, it didn't show an effect, they could have predicted that based on it was a monkey studies, and it was done in infants in South Africa. I mean, ethically, how you can do that, I don't know, as a researcher, manipulate your own data to test on infants. But what's happened is when that trial was published in a high impact medical journal, they said it was a surprise that, based on the animal data, it was a surprise that the trial showed no effect, and money was taken away from TB research and thinking, well, we need to find new animal models. Well, that wasn't the case. If the animal models that we'd seen showed there was likely to be no effect. So the whole area now has been distorted by misrepresentation of data. And that's not, so when you see things like that, and it's actually to go and test a booster, a BCG booster in babies, fraudulent again, and these are high profile academics. I'm not naming them. It's all in the BMJ, and File on 4 did a piece on it on the BBC, but and that there was a lot of blowback, and it's really sad.
Mm-hmm. The follow-on question from Francois on exactly what you just said. So do you think that public health authorities should have structures aimed at investigating research misconduct and meta-research?
They should do, shouldn't they? I thought they did. They're supposed to, I think. The Office of Research Integrity, I forget their name, so I will, but they do. And I know we went to, certainly with this particular story, the BCG one, the scientists work, because again, there was a whistleblower involved in that, very brave whistleblower who did go on the record. He had to leave his institution. He's at another institution now. You know, he fortunately has found another job, but he was quite he was distressed about what happened. And those scientists he brought case against those scientists that misrepresented the data, but their institution kind of gave them a clean bill of health. You know, it's too big to fail. You know, you do, are they too big to fail? I mean, and that's it. And even with the cabbage versus stent piece, those researchers who have withheld or not published, you know, key endpoint outcome data, they're still going around the conference circuit and as powerful as ever and things like that. So things like that are disappointing.
Mm. Very rarely we see the headlines or the news that a particular researcher was imprisoned or somehow legally punished or lost the job or stood down because of the fraud and misconduct. But it is indeed very rare considering the amount of misconduct happening and cover up by academia, by industry, by policy people, by politicians. Do you think we're missing important legal tools and legal frameworks to enforce such punishments more effectively, or it's such an I don't know, like why is it not working basically? Why are there so few cases where wrongdoing is being properly punished?
It's a good question. Maybe it is the lack of frameworks. If you think about the harm done, misrepresenting data. So, you know, you misrepresent data on something, you know, cabbage versus stent. People are potentially having a life shortening intervention, you know, or not life shortening. They're having an intervention that is inferior to another one, and they potentially could have lived longer. You know, when you're talking about health, it is particularly serious. And I don't know whether it's the powers that be that, you know, they bring in a lot of money. I don't know. I'd love to know what the solution was. Sometimes you feel it's kind of the low-hanging fruit, that the people that are low-hanging fruit, that well, we don't mind getting rid of them, but we don't want to get rid of one of our big guys. They bring money into the institution. So I don't know why health isn't. I mean, you see it happen with bankers, you know, and again, not very often. And again, we don't know the scale. I mean, one of the problems is actually what is the scale of fraud and misrepresentation? But by definition, it's very hard to know, because we don't necessarily know it's always going on. We can't look at it. It's very hard to look at systematically. So, but I don't know why people aren't held to account more. And actually, it's not even that. It's, if you think about the impact and I sometimes think mud doesn't stick. I mean, you know, and I don't want to again single out, but if you think about the MMR study that was published, and you know, that hasn't really impacted. And again, it, you know, I know people have got friends on the Lancet, but that hasn't really impacted the reputation of the Lancet. And you think about the potential harm done there. It's interesting how healthcare works.
Going back to the whistleblower issue, we have a comment and question from Dr. Charlie Bennett, who was a speaker at Consilium. We also hosted a talk by Nancy Olivieri, whom you know very well, I'm sure. And what Charlie is wondering is, have you seen whistleblowers' fates end up like Peter Wilhost, Olivieri, and him, basically where life is ruined in many ways, and should we advise whistleblowers that they will lose their jobs, friends, and possibly house, and have further repercussions?
You don't want that to happen to you, because we need whistleblowers so much, and particularly when freedom of information just isn't functioning in the way it shouldn't. Yeah, I have seen. I mean, I've seen people lose their careers, and you, and obviously it's never as bad when you're the journalist, but when you see it happen to your sources as well, it's devastating. And you know, I've made a mistake before, and I've exposed a source totally accidentally on camera, where I showed a document that had where they were working and they got tracked down. And it was the rush of the pandemic, where normally you were in you're in edit suite, you couldn't gather in edit suites because of, you know, rules around kind of keeping a distance. So normal checks and balances just didn't happen. Everything was rushed, and normally you'd go through you normally go through what you call rushes, which is the video, and you know, you'd look at them, and I missed it. And he was found out, and he just about kept his job. And when things like that happen, you just, you know, that obviously it was far worse for him than it was for me, but it was devastating. And it we yeah, I mean, I do say to people, what is going to happen? But quite often, by the time it gets to me, a lot of that stuff has happened. They've been and the final straw, by the time they get to the media, they've done, you know, gone through all the other channels that they've and tries to raise concerns. But yeah, they can be pilloried and cast out. And another one of mine sources in a story who's in the United States was subpoenaed to get all his internal documents and email exchanges with me. And that was quite scary. And that was really scary for him as well.
Is there anything you do, and if you cannot answer this question, that's fine, personally, in terms of your communication? Do you just use regular phone, regular email, or do you have some encryptions, or do you have some ways of communicating even on a regular basis, or it's just not worth it?
Yeah, I mean, there are things like Signal. There are certain apps that are more secure, and certain documents. So we've done investigations where we've used Signal, and documents have been sent through Signal rather than email. And when I was hacked, yeah, it makes you far less complacent about use of email. And we talk on the phone, WhatsApp. But Signal is one that often that we'll use, that's more encrypted, and we'll send documents through Signal.
Mm-hmm. For you personally, it's been an almost ideal sequence of events, having medical training and ending up as an investigative journalist in healthcare. Do you have any colleagues who also do healthcare investigative journalism who are not medically trained? And is this even possible? Is it advisable? And what are the challenges? And for example, would you be able to do investigative journalism in non-healthcare related field? Because I'm sure there are some skills relevant to just getting to the story, getting to the people. So it's not even about the subject. So where does that qualification need comes into?
Well, healthcare's so broad. I mean, I always say, give me a story and I'll give you a health angle. I mean, health takes in, and again, when you work on the BMJ, they take a very broad look at healthcare. So and I think a lot that the Lancet does as well. So it's everything from social policy and food policy and tobacco policy and alcohol policy. So if you think about the industries involved in healthcare, major industries, you've even got climate and fossil fuel, right through to, so the skills that you develop, the thing that I'm not great with is money, just generally speaking. So I can do follow the money stories, but going through company accounts, I wouldn't know where to start. So, you've got specialist finance journalists there. Most journalists, health investigative journalists, most don't have a science background, actually. So I'm unusual in that sense. And I think there are definitely pros and cons. I think it's good to work in a team of people that, with different skill sets. And actually sometimes people that don't have that background will ask very different questions and see things from a very different perspective. And it stops me going into the weeds too much, I think. So the combination can be quite powerful. And there are plenty of really good journalists who
Yeah, that leads me to another question. Out of the stories you work with, because you worked for some very big organizations and programs, how much of your work was a solo investigator and you had to keep it to yourself because of secrecy, for example, because of access to documents, and where it was truly teamwork, where you think it just happened this way, or it benefited? Like, which part, how would you say investigative journalism works? Is this a solo job or is it a teamwork?
It's always a team, because you've got the editors, that do some of the, a lot of the background, do the editing. You've got the legal team, the likes of BBC. You've got producers, you've got camera people, you've got, people in editorial policy. So there's even it might be my name on a piece. There's other people involved. There's people that lay it out on the page when it used, if it was in print. So it's always a team effort. And then most importantly, I never work alone on a story. I'm always working with my sources, and they're largely doctors and researchers and academics and healthcare professionals and scientists. So there's always an element of team in it.
It sounds like working on a particular story is such an all-consuming activity, which takes days, nights, months, maybe years, and you establish a relationship with people that you work with. Does it happen that you actually keep in touch with sources, keep in touch with different people that you met throughout particular investigative pieces? And I'm not talking about professional connections, a cameraman, for example, or a lady who was helping out with technical aspects, but I'm talking about the person who was deeply involved with that particular story. Or it's better not to keep such connections and they need to be killed for whatever reason.
No, yeah. I mean, I'm always, because you want to know people are okay. At the end of it, you want to make sure, because, being dragged when you're a journalist and you're either in front of camera or you've got, your name on a piece, you're used to kind of being in the spotlight a bit. And so you do keep in touch to a greater or lesser extent. And I a lot of the time I leave it up to leave it up to them. But academics that I've worked with in the past that I'm still in touch with, very much so.
Mm-hmm. So another question is about politicians, and it does happen that on purpose or inadvertently, they might be promoting misconduct. And a question from Francois giving an example of Macron visiting Raoul during COVID pandemic, who was promoting hydroxychloroquine, and it led to the whole step-by-step events of him fighting back and many other people discrediting his work. And then we know what happened with hydroxychloroquine in the end. And we've seen things happening in America where politicians go way above and beyond promoting particular things. And you cannot demand a politician to know how medicine and science works. Of course, they rely on advisors or not necessarily medical advisors. Sometimes it's political hype, marketing, or lobbying. So what happens there when politicians who have such an impact, such an influence on the society promote misconduct?
Gosh, I mean, it's bad. You get. It's hard to really know how to respond to that. I mean, yeah, I mean, they give it oxygen, don't they? They give the something that might be. And again, I'm not a massive fan of the term misinformation when it comes to health. I think health is a bit more. I think there are obvious examples of it, but I'm a little bit more. I think health is more about uncertainty, misinformation. I'm not totally sure what the definition is, and misinformation is very much this is certain, this is definitely wrong, and we know evidence changes. And it's much about reducing uncertainty, isn't it, as it is about absolute certainty. So I mean, it's clearly it gives oxygen, and that can't. I'm not sure that's entirely a good thing. I do think people are worth. I mean, I would never not speak to somebody. I would never not listen to somebody, because I think you learn a lot from people you don't necessarily agree with, or they might have valid arguments, they might misrepresent them, but there might be some valid arguments in amongst everything. And I think just shutting the door and saying, well, I'm not going to speak to them because they're clearly wrong, I don't think that's healthy particularly. And you can think, oh, maybe they might have a point there. So, but I'm not saying that with people that are fraudsters and everything else. I mean, one of the pieces I did for the BBC was about Paolo Macchiarini, and about his surgery and some surgery that went on in Great Ormond Street. And again, he was out with all the kind of, hotshot people and politicians and things like that. And it promotes him. It's his profile. So yeah, it's clearly, but then you want your doctors and scientists to be honest. You assume, and doctors and scientists are still held in, I think it's dipped a bit, with the pandemic, but they're still very much held in high regard. So, I think it's up to us, I suppose, if I see myself as a kind of scientist, doctory type person, to kind of uphold integrity as much as anything else.
Deborah, thank you so much for this very insightful whirlwind of a conversation. We learned a lot. And however interesting your stories are, I think your personal story of your career, of how much you have done, how much you have seen, how much you have experienced, definitely deserves not an article. I think it deserves a book. So do think about that. And maybe you can team up with Nancy, other whistleblowers, and we definitely need proper documentaries on Netflix or maybe films. So there's such an important, a lot of people who are not looking into these questions, they don't even know how much is going on in the background to uncover certain things, how fascinating this world is. So I think definitely it will attract a lot of viewers. And thank you so much for your work. Good luck. Hope to see you at LSE. And this conversation has been recorded and will be made available. So if you joined late, so you can catch up later and watch it later. And otherwise, we'll see you in 2 weeks. Thank you, everyone, and have a good evening.